A week ago today, a blast in the port of Beirut killed more than 150 people and injured 6,000. Well, now the country is dealing with another crisis. The prime minister and his cabinet resigned on Monday. So recovery efforts in Beirut have been hampered by violent protests, but that's not stopping UNICEF from doing what it can to assist in the relief efforts. The deputy representative for UNICEF in Lebanon joins us now this morning via Skype from Beirut, Ms. Violet Speek-Warnery. Thank you for being with us, Violet.
Good morning. Yes,
there is so much going on there. I want to first start with you. Where were you when the explosion occurred?
Well, I was actually in this room. I'm at the moment working, of course, in the field, but also very much working from home because our office was damaged. But I had just come back, and because of COVID, I had to be teleworking from home. And so I was here, and yes, everything shook. Movement, and actually all my neighbors lost all their windows and everything else, and somehow I have been spared. I have a little angel on top of me.
Absolutely.
But the rest of my staff and the UNICEF staff have been painfully affected by this as well, and with multiple injuries, houses lost, and also unfortunately a death of a colleague.
We were just looking at video of the explosion. The devastation is just insurmountable, and we're trying to understand this. The cabinet has resigned, the prime minister resigned, there's political turmoil, but in the midst of it, you are trying to help those who are injured. How is UNICEF doing that on the ground? So I imagine that a lot of your impact has been hampered by the fact that you can't get medical supplies, the fact that hospitals are shut down.
Yes, but it doesn't stop the work. I think things have been damaged, but still, as an emergency organization, and we move. So in areas of protection, health, water, these are the main areas that we've been very actively engaged with. And first, just being able to salvage what's there. So, for example, vaccines and medications that were at the port actually right after the blast, going to try to protect those, which we did. Actually, vaccines and medicines were protected. A newborn healthcare unit was there, making sure that those newborns were brought to another area right from the start, providing those frontline workers with food and water. So this has been sort of from the beginning. And also very clearly what was a main point for us was to make sure that children knew where their parents were and that the parents knew where their children were. It was a very chaotic event, and children were brought to different hospitals because, as you said, some hospitals were damaged. So they had to go to hospitals even further outside of Beirut, and their parents as well, and it wasn't always done together because there just wasn't space in the car or in the ambulance or on the motorcycle. So that was a big exercise the first initial months or first initial days to make sure that children knew where their parents were and the parents knew where their children were.
It is just
and
heartbreaking.
In the meantime, also, we've already had a plane come in with tetanus vaccines, for example. We have another plane coming in with surgical masks, gowns, all the materials that are needed for the response. And we've worked a lot with young people. Young people have come out in drones, and we've been supporting their efforts to come out and do support. And the support is about going to people's houses, cleaning their houses, an elderly who's 5 stories up. How do we help that elderly, give them water? The young people have been providing food, and we've been just facilitating that. So helping them with protective equipment, helping them with brooms, giving them materials to be able to give back, because the issue of mental health, this trauma that has been, put on children, young people then want another avenue. And this actually, by giving back, is a really great avenue for these young people also to give back.
Heal from it,
so
yeah. And I'm sure that a lot of people are just in shock by this. I mean, we've been looking at video not only of people helping, but also people still at the same time taking the rubble out by hand because they're still digging through all of that. Help us understand here in the United States what we can do, because we have a large Lebanese community here in New York. Everyone's wondering, how can they help? What can we do?
Well, yeah, there's definitely on the website, there's a place where you can donate. I think a lot of diaspora indeed is in the United States and in Brooklyn specifically. So I'm sure they're helping their families out directly, and I think that's really, really important. And of course, besides UNICEF, who works with a lot of national and local non-governmental organizations, there are these organizations that need that support. So I think this is a very poignant period of time, and it's not just now. Of course, it's had a very difficult year in Lebanon with protests, with an economic crisis, a severe economic crisis, which is still very much ongoing. The COVID, like you were just in your program, you're talking about it as well. The COVID is increasing at the moment in this country because of also the hospitals weren't able to practice the same sort of
it's one thing on top of another. Violet, it's great work that you're doing. We appreciate you joining us. I wish I had more time to chat with you today, but it's important to know that there are ways that we can help here in the U.S. So thank you for all the good work that you're doing. We appreciate you joining us.
Much appreciated. Thank you very much.